Ballot item number 54, Order M255, second reading of Bill 255, an act to proclaim Sickle Cell Disease Awareness Day and Thalassemia Awareness Day. Ms. Kenjin.
Thank you. Ms. Kanjan has moved second reading of Bill 255, and I'll turn to the member from Barrie Innisfil to introduce second reading of her bill.
Thank you. Thank you, Speaker, and I want to thank my fellow colleague who's co-sponsoring this Prep Members Bill with me, the MPP from Mississauga Lakeshore. And we wanted to raise this very important issue in Ontario, and of course it's a very important issue throughout Canada, and that is the issue of sickle cell disease and of course Thalassemia as well.
We're going to move second reading before you get into debate on the bill.
Thank you, Speaker. I move second reading of the bill to proclaim June 19th in each year Sickle Cell Disease Awareness Day and May 8th in each year as Thalassemia Awareness Day.
Okay. So pursuant to Standing Order 101, the member has 12 minutes to make her presentation. Turn back to the member from Barrie Innisfil.
Thank you, Speaker. And I rise to speak to my private member's bill, the bill to proclaim June 9th in each year as Sickle Cell Disease Awareness Day, and of course May 8th in each year as Thalassemia Awareness Day. And this is a private member's bill that is co-sponsored by my colleague, for the MPP from Mississauga Lakeshore. We both recognize, as everyone in this legislature and across Canada recognize, that there needs to be more awareness for these two different blood disorders that are so prevalent, not only in Canada but in Ontario. In fact, for example, sickle cell, there's about 6,000 Canadians that suffer with this particular blood disorder in Canada, and of that 6,000, there are 4,000 that live in Ontario that have this blood disorder. And I wouldn't have known as much as I do about these disorders if it wasn't for Landry. And she came to my office. She's the founder of the Sickle Cell Group of Ontario, and she met with me when I first got elected. We met in my constituency office, and she's very close by, just in a town next door, and she spoke to me about sickle cell and the need for awareness and what the province could also do to raise awareness and more resources and advocacy, of course, on the issue. And she went into her story and how she got involved with the Ontario Sickle Cell Association. And it's very touching because her brother was affected by sickle cell. And, as she mentioned to me, and she provided a quote for me to read in the legislature, she recognizes, and the work that she's been doing with the organization, that globally sickle cell disease, and this is a quote from her, globally sickle cell disease and thalassemia are the most common genetic blood disorders affecting millions of people. Preventable complications suffered by individuals affected by these disorders include damage to vital organs of the blood and premature death. In the words of Sunday Afalbi, this is her brother speaker, in whose memory the Sickle Cell Awareness Group of Ontario was established, I look forward to the day when no one will ever have to suffer from this debilitating complications of sickle cell disease. The province of Ontario recognizing June 19th as World Sickle Cell Awareness Day and May 8th as International Thalassemia Awareness Day is a step in the right direction as we work towards equitable care for individuals and families affected by sickle cell and thalassemic disorders. And that's from Landry. And I know she's watching, and many members of the Ontario Sickle Cell Association. I want to thank them for their advocacy. And I know something we worked on together before this bill was tabled is, of course, we held a day here at Queen's Park, a reception where we had members that were affected by sickle cell, their families or themselves. They came from all across Ontario to this Ontario legislature to share their stories with them, and they were very touching. And it allowed me to reach out to more members that were affected by this. And today, and I speak with her often, but a lady in my community, her name is Titi. She's a local entrepreneur and a data privacy professional, and she was very touched by by sickle cell as well. And her story, and a quote I want to read from her is, "Sickle cell anemia is a common genetic disorder that has been personally experienced by loved ones by loved ones of her. And the person that she knows that was affected by this is none other than Toshkin Bucknor, who many may know this particular influencer. She's not only publicly known as Toshin, as a friend, she was a friend of hers from a young age, but she's known in Nigeria not only as a very famous radio host, but she's also a very well-accomplished lawyer. And this is one of TT's friends from a very young age. They were friends since 9. And it was reported, and CNN did a story on this individual, Toshin. She died at 37 years old, Speaker, from complications of sickle cell. She left a legacy behind, a husband, and of course, all her radio fans, celebrated the great personality that she had. She loved life, and she really lived it to the full extent. And as TT had told me, a friend known very well, publicly known, and she knew her from a young age. She says, I quote, who I watched as she lived through many painful crises as it was called sickle. When she was called a sickle cell carrier. She lived her life and lit up the world in everything she chose to do. A lawyer, an on-air personality, but most of all, a really good friend, a sister, a daughter that Canada will choose to recognize June 19th at this point in time, not just as a form of recognition, but to actually raise and increase awareness around this disease, and this is a very great step. She goes on to say, thank you in memory of many of the Toshin Bucknors around the world, living here in Canada by birth, Canadian, or by adoption. We say thank you. And that's from her, and of course the effect that she had for one of her very good friends. But before I continue, Speaker, I did want to mention that I am sharing my time with the member from Mississauga, for my colleague who's also sponsoring this private members bill with me, the member from Mississauga Lakeshore. So I'll let him continue about the very importance of this bill and how we need to stand up for those individuals that are suffering with sickle cell and thalassemia, and call out an awareness day and continue advocating on their behalf. Thank you.
Thank you. Yes, you did indicate you were sharing your time. We turn to the member from Mississauga Lakeshore.
Thank you, Speaker. I'm honored to join my friend today, the member from Barrie Innisfil, in presenting Bill 255, the Sickle Cell Disease Awareness Day and Thalassema Awareness Day Act. I particularly want to thank Landry, the president of Sickle Cell Disease Association of Canada, and Rayard Albrad, president of Thalassemia Foundation of Canada. It's because of their dedication and hard work that we're presenting this bill today. Speaker, sickle cell disease and thalassemia are two of the most common genetic disorders in the world. It is estimated up to 2% of the world's population are healthy carriers of this gene from thalassemia. According to the World Health Organization, up to 5% are healthy carriers of this gene for sickle cell disease, with the percentage as high as 25% in other regions. In both cases, patients have abnormal red blood cells which cannot provide proper oxygen. This can damage even every organ in the body, including the brain, heart, and lungs. And the consequences can be devastating, from severe chronic pain to organ dysfunction and bacterial infection, and ultimately lifespan reduction by almost 30 years. To take just one example, the Centre for Disease Control and Prevention reports that people living with sickle cell disease are at great risk for severe illnesses from COVID-19, and yet treatment, research, and awareness of this disorder in general lag far behind other chronic illnesses. Many Ontarians aren't aware that they're living with this gene, since they have no symptoms, but with both parents are carriers, there is 1 in 4 chances that children will have this disorder. It is estimated that over 6,000 Canadians living with sickle cell disease in some form. Since it's so rare, many frontline healthcare workers have only very limited experience with it. We know that some cases, people seeking treatment for pain from this disorder have been dismissed as drug seekers. The other issue is that painkillers don't address the underlying condition, and it is in a crisis, and delay in treatment can be life-threatening or even fatal. As Mr. Brad says, thalassemia and sickle cell anemia is chronic. and complex conditions. These require multidisciplinary care, similar to providing wide care program established decades ago for cancer. At the time, a stem cell transplant from someone without this disease is the only known cure for sickle cell disease. However, this requires a donor with closely matching bone marrow, like the healthy brother or sister. That isn't always available. Fortunately, promising research is underway into other potential cures. Speaker, it is also important to note that devastating impact that this disorder can have within certain communities. Mississauga Lakeshore is home to many new and vibrant multicultural communities. Many trace their roots to India, Southeast Asia, Africa, South America, the Caribbean, the Middle East, and the Mediterranean, all areas where sickle cell disease and thalassemia is particularly common. As Ontario becomes more and more diverse each year, it is important that we do everything we can to raise awareness of this disease that impacts our multicultural community, including new Canadians. At the same time, Ontarians of all races can have sickle cell disease or thalassemia. Thalassemia is common, for example, in the Italians from Sardinia, Sicily, and Calabria. June 19th is recognized as the World Sickle Cell Day by the World Health Organization and the United Nations. May 8th is recognized as Thalassema Awareness Day by the Thalassemia International Federation and by organizations around the world. By formally recognizing the day in Ontario, we can help to educate communities about this disorder in schools and workplaces across the province and help to raise awareness of the importance of early detection, effective treatment, and prevention. It is true that this is only a small step, but we believe it will help lead to a more compassionate and better healthcare system. And I want to take a moment to thank everyone who has written to us to support this bill. From Dr. Robert Kassan at the Children's Hospital of Eastern Ontario and Dr. Zaad Saal at the London Health Science Centre, and especially the parent like Mary Alfonso from Mississauga. Mary is a mother of twins with thalassemia. How many times, she wrote, I have spoken to families only to find they were not aware of thalassemia, the impact that may have on their lives. This bill, she said, marks the beginning of a new era. I see the brighter future for their kids. I see professionals working together to educate and inform people. I look forward to working together with the members to help make life easier for families like Mary. Thank you.
Thank you. Further debate. I recognize the member from Toronto St. Paul's.
Speaker, while a day of significance on sickle cell and thalassemia is cute, this Conservative government has been in office almost 3 years. This government bill is performative. It is low-hanging fruit that panders to Black and other racialized community members with sickle cell disease. Speaker, this shouldn't be a political game. This is life and death for people with sickle cell disease. A bill like the member from Barrie Innisfil, without any explicit standardized hospital universal protocol, any requirements for the Minister of Health to conduct reviews to ensure health care funding is sufficient for patients with sickle cell disease, which we know it's not, and without full commitment to race-based data collection to ensure health care meets the needs of diverse groups with complex needs, is toothless legislation. Our NDP bill, Improve Access to Health Care Act, put forth by myself and the member for Nickel Belt, our health critic at that, demands all of the above and more. Sickle cell is a severe illness that impacts red blood cells. It affects the quality of one's life, can destroy families, and is often fatal. Excruciating pain attacks, Speaker, can happen without warning. While sickle cell disproportionately impacts Black and South Asian communities, as the government now knows, understand we've been talking about sickle cell for the last 2 or so years in this legislature. They just woke up the other day. It is a disease that affects people of all races. For far too long, Ontarians living with sickle cell anemia have received varying degrees of care when they rush to the emergency in crisis. Shamefully, many with sickle cell are mistreated when they most need help, from being callously and racially profiled as drug seekers or drug addicts to being subjected to incredibly long wait times while in pain, and in many cases having pain medication withheld or dying in the ER because no one at the hospital knows what the heck to do and how to respond to sickle cell disease. Organizations like Sickle Cell Association of Ontario have been leaders in the fight, advocating for the universal protocol and all the previous commitments I mentioned at the top of my speech, long before I was ever the MPP for Toronto St. Paul's, for years. I met Sickle Cell Association of Ontario's team, including President Lisa Bailey, Ulysse Guerrero, Patient Support Director, and Alvin Merchant, Communications and Marketing Director, who shared candidly their personal experiences with sickle cell in healthcare. I've also spoken extensively with doctors, including Dr. Moody. SCAO and sickle cell communities across Ontario have been calling for a universal hospital protocol, ensuring sicklers receive consistent quality of care at every single hospital in Ontario from all frontline health providers. A day is cute, Speaker, but for goodness sakes, where's the meat? Where's the teeth? Where is the actual action in this legislation that's actually going to save people's lives and not be political simply because an organization's leader happens to live in the members' riding? This is ridiculous. For 15 years, consecutive Liberal governments had the opportunity to improve health outcomes for people living with sickle cell through the quality-based protocol. But instead, they shelved this, leaving Ontarians with sickle cell twisting in the wind. Even former member of the Liberal Party, Mike Coles, tabled a bill on sickle cell, and it went nowhere. The Liberals were in power, and it wasn't a priority. Now this government is in power. There is still no requirement in this government's day of celebration/acknowledgement to enforce the handbook, to enforce a universal hospital protocol that saves lives. Hospitals are independent operators that receive provincial funding. There must be legislation on the table that calls for the universal protocol. The legislation must be real legislation, not a calendar day nod. This should be about saving lives, Speaker. It's about creating legislation that would actually save a minimum of $43 million in healthcare spending. This government's bill does none of that. I thank SCAO, I thank SCAGO, I thank every organization that's been doing this work and people living with sickle cell, but community, led by SCAO, is demanding universal hospital protocol. This bill is a birthday, it's a celebration, it's an acknowledgement day in the park. It's not about actual changes that are going to help save Black and brown and other racialized lives. It is toothless. Shame on the government for playing politics with my people's lives. Thank you.
Further debate, the member for Scarborough-Guildwood.
Thank you, Speaker. It is always a pleasure to rise in the House to speak on behalf of my constituents of Scarborough-Guildwood. And, you know, I certainly recognize the government members for putting forward this private members bill to proclaim Sickle Cell Disease Awareness Day and the Thalassemia Awareness Day. Sickle cell disease and thalassemia are the most common genetic conditions in the world and affect many people in Ontario. Sickle cell and thalassemia diseases are important issues in my riding of Scarborough-Guildwood. I want to remind all members that in 2017, the House of Commons did pass a National Awareness Day for sickle cell on June 19th, and it's something that I certainly celebrate each and every year. This bill was sponsored by Senator Jane Cordy from Nova Scotia and championed by MP Gary Anandasangari from Scarborough Rouge Park. And, you know, it is also recognized worldwide by the World Sickle Cell Day, by the African Union, by the WHO, and the United Nations. So it is appropriate that this legislation affirms its support for these days. And in Scarborough, the fight against this disease has been spearheaded by the local health team at the Taibu Community Health Centre under the leadership of Executive Director Liben Gabramikal. And since 2017, the community-based health organization has committed its focus on how do we improve these services, particularly to the Black community. Taibu has been working with different groups engaged in the education, the advocacy, and the psychosocial supports for individuals with sickle cell disease. The Sickle Cell Association of Ontario, founded in 1981 by Lily Johnson, has been working to educate and to raise awareness of the sickle cell disease. I had the honor of meeting her at an International Women's Day event at the Jamaica Canadian Association, and then again at her 97th birthday celebration 2 or 3 years ago, in fact, when she was at Taibu Community Health Centre being honoured. And I got to tell you, she is a force. She was named to the Order of Ontario in 2006 for lobbying that led to sickle cell disease being included in a standard newborn screening across Canada. And Ms. Lilly was Ontario's first Director of Public Health. Her first Black Director of Public Health, and her advocacy for sickle cell screening has led to that newborn screening for all babies across Ontario. So while I support Bill 255 to proclaim these days of awareness, it doesn't go far enough. Members opposite, we need to take action now. We need to implement the recommendations set out in the Clinical Handbook for Sickle Cell Disease Vasculitis Crisis, which was published by the Provincial Council for Maternal and Child Health and the Ministry of Health and Long-Term Care in 2017. This important document was developed and implemented by the previous Liberal government. And we know that thousands of Canadians suffer with these diseases, and thousands more are impacted as friends and family suffer constantly. We know that in the time of the COVID crisis, this concern has become even more acute because people are looking at the compounding of these immune issues and the effects of COVID-19. In fact, when you think about mental health and anxiety, and that support is just not there. This is Black Mental Health Week, and I want to make sure that we put those issues on record as well, because more support is needed. So I fully support moving ahead with the emergency room protocol that has been developed by Taibu Community Health Centre. It's implemented in Scarborough's 3 hospitals, but it's something that could be spread across all hospitals in Ontario to reduce the wait times, to reduce the costs, and to improve patient care and patient services. The last thing I want to say is that both of these diseases severely cut off the lives of individuals, sometimes by as much as 30 years. My schoolmate, Brian Sinclair, who I met at the University of Toronto Scarborough campus, he had sickle cell disease, but he was a gifted musician. He was a father, a son, a brother, an uncle. And sadly, after battling this disease for many years, he succumbed. So his children will not have the benefit of their father. His partner will not have the benefit of her husband. And so this Awareness Day I support, but we have to.
Further debate, the member from Ajax.
Thank you, Mr. Speaker, and thank you to all of my colleagues speaking on this important issue, and particularly thanks to my colleague from Barrie-Innisfil and from Mississauga Lakeshore for bringing forward this important discussion and this important bill. Discussing sickle cell disease and discussing thalassemia are important ways that we bring awareness, and I do agree that it should not be just about awareness. As I said in this legislature last week, in reference to Black History Month, my own riding of Ajax has a population of 16% identifying as Black, the largest percentage population of any community. And although these diseases do not just affect Black Canadians, that means that disproportionately it affects people in my constituency, and it is certainly something, and the challenges of it is something that's been shared by members of my constituency with me. Some of the facts about sickle cell have been raised, and I think it warrants raising some of the broader issues, Mr. Speaker. We know because the research has been done by no one less than the New England Journal of Medicine, and a report I'd recommend from Drs. Hayes and McCann. This is of November of 2020, and Mr. Speaker, the New England Journal of Medicine, known for dealing pretty explicitly and effectively with medical issues, but not so much with social issues, speaks in this report about the role of anti-black racism and the role of systemic racism in terms of the emphasis on a disease like sickle cell. They point out that in the U.S. context, although there are 1/3 fewer Americans that suffer from cystic fibrosis, there have been 7 to 11 times more money spent on research than on sickle cell. And they ask the question, why? In my own research, we find that here in Canada, 50% more Canadians, and my colleague mentioned 6,000 in total, 4,000 in Ontario, but 50% more Canadians suffer from sickle cell than from cystic fibrosis, and of course we're concerned about everyone's concern in disease, and although we don't have the statistics they have in the U.S., we might imagine that they could be the same. In the United States, we know the FDA has approved 4 drugs related to sickle cell, and I'll get back to those approvals because I think that is also something we have to be concerned about in the context of Canada. But there have been 15 drugs that are for the treatment of cystic fibrosis. So, Mr. Speaker, this raises important questions we have to ask about equity in our health system, and it's important questions that I think the focus of these 2 days are pivotal in raising those issues. This isn't the end of a discussion. As my colleague from Scarborough-Guildwood mentioned, in 2017, the federal government created a day of awareness that aligned with the international days. I think this legislature should be proud that it is the first provincial legislature to bring this forward, and I know that the Canadian Sickle Cell Association is very supportive of that and wants to see this conversation taken forward, but it is a conversation that has to be taken forward. Mr. Speaker, I had the chance to speak with Biba Tinga. She's the president of the Sickle Cell Association, and I have to give her credit and her organization credit for my education on this important issue. She talked in particular about what could be done, and she said, and again, I referenced the conversation with her. The first drug that was approved by the FDA, a drug called Endaria, was approved in 2017. And Mr. Speaker, there are 3 further drugs seeking approval by the FDA that are currently in trials there. Mr. Speaker, that same drug has been more than 2 years in trials with Health Canada and is not yet approved. And again, Mr. Speaker, these are the things that we need to start to focus on, because treatments and support, in addition to what was mentioned by my learned colleagues, but drugs to support the lives of the families and individuals affected are something that is within our reach, but we must make sure that Health Canada understands that these are prioritized amongst many other things they have prioritized. When you speak to someone like Biba, and I know that all of us speak to people and learn, and it's one of the wonderful things about this role is that we get the opportunity to reach out and have these conversations. I had to ask her after our conversation, how is it that you came to be so informed and passionate about this? And that was because of her son Ishmaeli. They came to Canada when Ishmaeli was 15, and at that point, the kinds of treatments like bone marrow transplants that can work for 10% of patients and of those who suffer from it weren't available because he had been past the age which at that time they thought was advisable. But Ishmaeli is 32 years old today, and she knows that sickle cell anemia reduces the lifespans of those affected by it. On average, for men, it reduces them to 50 years. For women, it reduces them to 60 years. So she is fighting on behalf of her son, who is 32 and more than halfway through his life, unless the kinds of actions that a day of recognition like this and the further actions that need to be taken, and how those years will be spent, whether they'll be spent suffering as the disease progresses, whether they'll be spent dealing with some of the indignities that my colleagues talked about in the hospital system, in the medical system, or whether they'll be spent healthily and well, and whether they can be extended. These are the sorts of questions that she's fighting for, not just on behalf of her son, but on behalf of all of those who suffer from sickle cell anemia. So in saying that, of course, the things that we are doing today, I think are important. And I know that Biba is watching. She asked for the web address, and she wanted to be here virtually to see this debate. And I speak to her and I speak to all of those who've advocated for so long about this at the provincial level, at the federal level, and say that I think this legislature is going to speak as one about the importance of these days. Days of recognition are important, but also about the other things that we can do, the other important steps that we can do, whether it's the drugs or making sure those drugs reach the formulary and are available, treatments in our hospitals. This needs to be a priority. It should be a priority, and I very, very much support this private member's bill. Thank you.
Thank you. Further debate. I recognize the member from Nickel Belt.
Thank you, Speaker. And I have no problem with a bill that proclaims June 19 each year as Sickle Cell Disease Awareness Day and May 8 in each year as Thalassemia Awareness Day. But those are very tiny steps, speakers, when the road to recovery is long. We've heard everybody talk about the chronic pain, the chronic disease of sickle cell disease. We know that we have to do better. We know what we need to do, but all we say is we'll have a day to talk about it some more. I am really proud of our healthcare system. I come from the healthcare system, and I know that Ontario has a top-notch healthcare system. But you know what, Speaker? Racism is alive and well in our healthcare system. That's not something I'm proud of, but that's something that I have to acknowledge. And why am I bringing that forward? Because most of the people that are in crisis with sickle cell disease are Black and racialized, and they are not receiving the care they need when they reach to our hospital, when they reach to our healthcare system. We all know that this is a genetic disease, that we've known about a newborn screening since 1972. It took till 1987 to recommend it, and it took till 2006 before Ontario started to test newborns to see if they carry sickle cells. It took 34 years, speakers, just to get Ontario to agree to do the newborn screening, which means that for kids that are 14 years of age or younger, we have a pretty good idea that they have sickle cells. But for anybody who's older than 14 years old in Ontario, many of them don't know that they carry this disease, and many of them will find themselves in crisis. I'd like to talk about the clinical handbook. It has been mentioned a couple of times, the clinical handbooks for sickle cell disease and vaso-occlusive crisis that was published by the Provincial Councils of Maternal and Child Health of the Ministry of Health of Ontario. This is a fantastic handbook. It was published on December 12, 2017. And what did the Liberal government do with that handbook when they were in power? Nothing. And what has the Conservative government done with this handbook? Absolutely nothing. It has been shelved, although it was
Order, please.
made by Ontario for Ontario. I wanted to share the story of John River. John River is an award-winning Canadian singer. He has sickle cells. He shared his story with us of going to the hospital, of being deadly sick, of being turned back home, of his mother having to put on a button shirt and a clear pair of pants while he's unconscious at home to be brought to the hospital. Otherwise, they treat her son, as a drug-seeking person when he was that far away from dying, Speaker. It was his colleague, other singers, who came to his rescue and used their platform on television to say that John River needed help. He was being discriminated against because he's Black and he's sick and he needs care. This has to change, and a day to celebrate is just not enough. In 2021, we need to do more than this. I too would like to thank everybody at Taibu for everything that they've done. Libin Gibran Michael is fantastic. They've pushed this issue. Same with the Sickle Cell Associations of Ontario. We know what to do, Speaker, to celebrate the day. Yeah, sure. It's not enough. It's not enough.
Further debate. I recognize the Minister of Education.
I appreciate the opportunity to rise. I want to just first off express my gratitude to the member from Barrie-Innisfil for her leadership in raising this. In fact, one of my early memories in the legislature upon our first few months as elected was actually joining a sickle cell awareness event that I think you co-hosted, bringing community leaders, including from my riding, to Queen's Park to raise awareness for this disease. So I thank you for that and for the opportunity to speak today. Her bill, the Sickle Cell Disease Awareness Day and Thalassemia Awareness Day Act, would officially declare June 19th each year as Sickle Cell Disease Awareness Day and May 8th each year as Thalassemia Awareness Day. And I think, how vital it is knowing how debilitating this disease is for so many people, and the lack of awareness of this disease, I think is very important that we create awareness starting in this day, recognizing the World Sickle Cell Day the June 19th is recognized in part as that day. A number of organizations, including the African Union, the World Health Organization, the United Nations, also promote the day. And on November 22nd, 2017, the Canadian House of Commons passed Bill S-211 that designates June 19th in each and every year as National Sickle Cell Awareness Day. So similarly, May 8th is already recognized part of World Thalassemia Day. But the point, speakers, notwithstanding those efforts, there's more we can do. I think that is a reality, a multi-partisan reality, that we must do more to raise attention for the bill. And, part of it is humanizing the stories behind this disease, and not as an abstraction, but as a reality for many people, one of whom is an individual that I think many members in the legislature, including former Minister of Education and others will know, Shernette Martin, who is the president of the Vaughan African Caribbean Association, now Anchor, who herself was diagnosed as sick kids at age 5. And Shernette is beyond, being a mother, an educator, a community leader, and a champion for diversity in the country. She's also a sickle cell survivor. And when she was that young, she was told that her parents were told that she would not live past the age of 17. And these are the realities and the hardship that individuals face, the angst that comes with the day-to-day realities of living with this disease. Many people go through their lives advocating for support because there's very little known about the illness. And when Shernette was diagnosed, there wasn't enough research, there wasn't testing, there wasn't treatment options available to individuals and to her. Since 2006, hospitals are providing newborn screening in Ontario, but we recognize part of this from a health equity perspective is to make sure that they have access to the supports they deserve. And why I speak about this is because we look at the lifespan of individuals, that those that inherited this blood disorder can be reduced by as much as 30 years. Speaker, it's estimated that about 5% of the world's populations are healthy carriers of the genes of these two diseases, and that percentages can rise to as high as 25% in some regions of the world. While our province now offers universal newborn screening for these disorders, there is much more we can do to know what their exact prevalence is within our province. That's why it's important to raise awareness and to educate the province and the people of Ontario. And for this reason, Speaker, I would like to just take a moment to commend incredibly valuable organizations for the work they do. The first is the Sickle Cell Association of Ontario, founded in 1981 by Lily Johnson, a nurse, a midwife, a teacher, who went to serve as the first Black Director of Public Health in Ontario. And the second I want to note is the Thalassemia Foundation of Canada, which supports and funds thalassemia scientific research. My best friend in my formative years, literally growing up in Vaughan, was a friend named Robert that had thalassemia, among other challenges in his life. And I remember the early impacts, his development, to his spirit, to his confidence, and to the angst this brought to his family and really to the entire community at the time that was rallying behind him, given the life-saving work at Sick Kids that saved his life. And he continues to stand strong today. But it's for people like Shernette and like Robert and others that I think really need this support. They deserve our praise. And I want to just note, when you think about what this bill will help achieve, awareness sometimes can be trivialized. And I think there were some undertones of that today. I'd argue creating awareness of what the disease the impact of the disease and the supports that can be provided to these individuals is in itself is a strength, recognizing fully there needs to be a greater continuum of care provided to them. But for the member from Barrie Innisfil, recognizing, as I mentioned to her just yesterday, in my community, the 5th and 7th largest visible minority populations in King Vaughan, 5th being the Black community, 7th being the Hispanic community. I am proud of that diversity. That makes our country stronger. But I'm also proud that we have a member in this legislature from Barrie Innisfil who has taken it upon herself to champion this in this legislature, in this province. And that alone will, I think, provide a great level of confidence to those that continue to have the disease, that they have support, a multi-partisan support in this legislature and across Ontario. Thank you.
Further debate. I recognize the member for Ottawa Centre.
Thank you, Speaker. It's a pleasure to contribute to this debate. I also want to acknowledge, as the member from Ajax said, that Biba Tingo is watching this from home. She is the President and Executive Director of the Sickle Cell Disease Association of Canada. Her son's name is Ismail, just heads up to my friend from Ajax, changed the name, important to him. But this is where I want to begin with the remarks that I have today, Speaker. I want us all to think for a moment, for those of us who've raised children, of what it would feel like to have your child screaming in unbridled pain for good amounts of the day, in perpetuity as they develop. That will help most folks who are watching this, who've never lived with someone in the family with sickle cell disease, understand the pain and the anguish that begins simply with doing what you feel you must do as a mom or a dad to a child with sickle cell disease. I can't even, as much as I've heard testimonies from Biba and others, the great Unita Lewis from Ottawa, who's spoken out for her son Brent, who passed 3 years ago, I can't even begin to comprehend what it's like to walk a day in the life of someone who's lived that reality. So we're raising awareness about it. That's fantastic. However, as colleagues have said, as the member from Ajax just said, in the United States, we've had 4 new drugs approved for sickle cell disease. None of those drugs are on the formulary here in Ontario or anywhere in Canada. And I think it's incumbent upon us to make the acknowledgement that we are living in a pandemic right now, and when we had needs to develop a vaccine to help keep our country safe, particularly marginalized people safe, immediately the brightest minds in this country and around the world set to the task, and we have vaccines coming at a fraction of the time we thought they would come. But where have we been for sickle cell? Where have we been? Where have we been? We have been formulating nice thoughts. People like Unita and Biba have been standing up for their children, raising money on their own, reading medical texts. We have not been there for these families. So let's begin on an awareness note from that acknowledgement. We have functioned from a research perspective in a way that deprioritized Black, brown, and racialized lives. Let's just acknowledge that, as my friend from Nickel Belt said, and then let's move forward. I invite to see members of this government, I'm excited to see members of this government step forward, as a member from Ajax just said, with new health care demands upon this province, lead the country, insist with our friends at the federal government that the Patented Medicines Prices Review Board not, forget what we are missing. Thank you, Speaker. Thank you, members.
Thank you. This concludes this portion of the debate, but the member from Barrie Innisfil has 2 minutes to respond.
Well, thank you, Speaker. And again, I want to thank my co-sponsor for the bill, the member from Mississauga Lakeshore, and all the members who stood up today and made a change in history. Because today, thanks to my friend Landry from the Sickle Cell Awareness Group of Ontario, if it wasn't for her, we would not be debating and introducing this today. And all the hard work that the Sickle Cell Awareness Group of Ontario has done. To date, they've been working day in and day out with families all across Ontario, and they work one-on-one with these families. They've also worked to progress many life-saving drugs in this province, and we had the member from Ajax talk about how important it is to get these drug approvals, and this is the first step. The member from Mississauga Lakeshore did mention it is a small step, but we do need to continue, and we recognize that. But when members from the Sickle Cell Awareness Group of Ontario ask us to introduce an awareness day, we're doing it. This is what they've asked for, and we're working with them. I know Landry was mentioning to me that she's working with the Ministry of Health on the handbook. In fact, right now, they're working on converting that handbook to make sure that all the doctors across Ontario have it, and it's in an easy format and posters that people can access, so we increase that. While this may just be a day, it's much more than that to these families, to these lives that are on the line, and many of us in this legislature talked about those lives today. So we cannot look those people in the eye today and say, we're not going to have a day for her. Yes, I will look Landry in the eye and commemorate her brother and the fact that she lost him to sickle cell, and tell those people, we recognize your loss, we commemorate that loss, and we are moving forward because there's so much more to do. And we recognize other countries like England who have made great steps towards recognizing thalassemia and, of course, sickle cell and the improvements that need to be made in healthcare, and we're making strides that way as well, Speaker. But I wanted to continue to say not just that, but obviously the other comments we mentioned today in the legislature and other groups that have been involved, and I want to thank them for their support. Of course, also working with Raid from the president of the Thalassemia Foundation of Canada, and thank all those watching tonight. Know that we are here standing united for you, and I hope we can get support from all members of this House for this bill. Thank you.
Ms. Khanjin has moved second reading of Bill 255. Is it the pleasure of the House that the motion carry? Carried. Pursuant to Standing Order 101I, the bill is referred to the Committee of the Whole House unless the member has a preference for another committee. Phil?
I would like to refer the bill to the Committee on regs and bills. Thank you.
Is the majority in favour of this bill being referred to the Standing Committee on Regulations and Private Bills? Agreed. Agreed? All right. That's where it's going to go.